Oh,
Oh, that's right. Oh,
all right. Well, let's get this final meeting started. First of all, thank you so much for joining us December 29th, 2022 for the last Tri-County Health Department Board of Health meeting. I want to thank everybody for joining us this evening. First, we're going to get started with a roll call and any introductions that we may have. Joella, do you want to kick off this roll call for us?
Yes, I will do that.
Thank you.
Please state present after your name is called. Representing Adams County on the Board of Health, Rosanna Reyes,
present.
Julie Shields,
Present.
Julie Mullica.
Present.
Representing Arapahoe County on the Board of Health, Jan Brainerd,
Present one final time.
Dr. Thomas Faywell, sorry,
Present.
and Dr. Kaya Gallagher.
Present.
Tri-County Health Department Leadership, Michelle Askenazi, Director of Emergency Preparedness Response and Communicable Disease Surveillance.
Present.
Heather Baumgartner, Director of Community Health Promotion.
Present.
Jill Bunzinski, Director of Nutrition. Anyone know if Jill is attending?
Can you hear me?
There she is. Yep.
Okay. Let's see. Dr. John Douglas, Executive Director.
Present.
And I'm Joella Gonzalez, Administrative Assistant. Mame Furman, Director of Human Resources.
Present.
Brian Halavisek, Director of Environmental Health.
Present.
Jennifer Ludwig, Deputy Director.
Present.
And Brianna Pederuski, Director of Administration and Finance.
Present.
Roll call is now complete.
Great. Thank you so much. Was there any other introductions that needed to be made? Perhaps, did we call Bella in?
No, we don't. The three people here don't really need an introduction, but to be official, I will mention that Bella and Riley are receivers here. And then I'll also mention they don't need an introduction either, but Sid Overton and Randy Dement, our general counsel, are here.
Perfect. Great. Thank you so much. I think that's everybody we have. All right. Well, first action item is approval of the November 10th, 2022 minutes. Can I get a motion to approve the minutes, please?
So moved.
Second.
All right. All in favor of approval of those minutes, please say aye.
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 All right. Any abstentions or nays?
I'm sorry, I missed on this point. I just had one question about
Oh, yes.
on my name where it says late via telephone. Usually we don't do that. We might say in the minutes entered when I entered, but late via telephone usually is, I would ask that to be removed. I was present.
Okay.
Okay. Thank you. Thank you for indulging me.
Yeah. All right. And then we have a formal resolution as our next action item. Joella, do you have that resolution to display on the screen by chance?
I do. I'll scroll down.
Thank you so much. Thank you. Thank you. John, would you like to provide an introduction to this resolution and why are we having it?
Well, well, this is a resolution that came up in discussion with some of the board members. The question was whether the board needed to vote to dissolve Tri-County. And the answer we got from our general counsel is that that vote is not needed because by statute, we will dissolve at the end of the year when the new counties complete their withdrawal and set up their own health departments. However, Sid and Randy pointed out it would be quite reasonable for the board to pass a resolution of acknowledgement and appreciation. And I think that's the genesis of what we've got on the screen here.
Great. Is there anyone who'd be willing to make this motion for the final resolution to accept the final resolution as it's printed? Or is there any discussion around this final resolution?
Can we
Move
get
to
to scroll
approve.
down? Can we get to scroll down? This is Rosanna, sorry.
Yeah,
Oops, sorry.
stand by.
Yeah, there we
There
go.
we go.
Is that far enough?
Yeah, I just wanted to read the last part.
Okay.
Great. So I did hear Dr. Faywell with a motion, I believe.
I second,
You did.
Ms. Rosanna.
Great, thank you. So the motion is to accept the final resolution as written. I do have a second. Everybody in favor of adopting this resolution, please say aye.
Aye.
Aye. Any nays? Any abstentions? All right, the resolution has passed.
Julie, if I could, I just want on behalf of the department to thank the board for considering this. We know the board has appreciated our work, but it's, I think, fitting and certainly well received on our behalf to have that formally acknowledged with this resolution. And we will share this with all of our staff tomorrow. I know they will appreciate it as well. So thanks to the board for coming up with and following through on this eloquent statement of appreciation. We very much appreciate it.
Yeah, thank you so much, John. Okay, so next up is we're going to move into informational items. We're a little ahead of schedule, but hopefully that will be okay. Jennifer and Kelly, I'm not sure if Kelly joined us yet. But our first informational item is update on the new health departments. I see that we do have Jennifer with us right now. So
And Julie, real quickly, this is Brian. I'll be covering for Kelly.
perfect, great. Thank you so much. All right, so who would like to start us off?
I will jump in and share just very brief update. I don't have any slides.
Okay.
Just a verbal update on where we are and just so that you have confidence in the Arapahoe County Public Health Agency and what we will be able to honor of the Tri-County Health Department. So I am beyond thrilled to say that we have 173 employees starting with us in January. I think you may remember, I think my goal was 130, and I thought that was shooting high. We are at 173. There are 3 offers pending, and we have an additional 40 temporary staff who will make up the COVID response team. So I could not be more thrilled with those results, and the majority coming from Tri-County Health Department. So great expertise and talent coming over and staffing the new health department. We have selected Dr. Christopher Urbina as our Chief Medical Officer. He filled in as an interim role and then applied for the through a bidding process, and he has been selected to be our contract Chief Medical Officer. So he's been assisting with getting the clinic set up, helping with employee health and a lot of other contracts. So we will be ready to open our doors. We've got a big celebration grand opening planned for Tuesday the 3rd. We will be off-site at the fairgrounds doing a big welcome orientation and getting everybody ready. And then they'll be at their offices that afternoon to plug in their computer, test systems, test the phones, and start to, respond to calls that come in between midnight on the 31st and the 3rd. Also really thrilled, and this all came in at the very last, feels like all the last 2 weeks, but all of our revenue contracts that we were expecting have been fully executed. So which took a huge effort from both the CDPHE side as well as Arapahoe County. the attorney assigned to public health has read, I don't know how many contracts and MOUs and policies and agreements. She read the entire HIPAA policy and rewrote all of the HIPAA policies for Arapahoe County. The HIPAA privacy officer and security officer have done, put everything in place to be able to receive data and personal health information to make sure that we don't skip a beat with seeing our clients. So it's been a huge undertaking, but we are ready, and there will be hiccups. But almost everything that we were doing here at Tri-County Health Department will be moved over to the new health department. There are things that just didn't make sense to continue because we don't have the same jurisdiction or the breadth of population. But there were a lot of them were just programs like the dietetic internship program. It would, such an amazing program, but it didn't make sense for a single county to do that. So we worked with the state, and Jill can talk a little bit more about where that landed, but we are not doing that in Arapahoe County. But everything else, all programs and services that Arapahoe County residents would have received from Tri-County, they will get from Arapahoe County Public Health. So it's with a lot of mixed emotions that we end this week with Tri-County and turn the switch on and get excited to open the doors with Arapahoe County. And such an amazing learning experience this year has been, and a great opportunity for the future. And I'm just so excited to be able to bring over such amazing talent, from the leadership to all of our WIC educators. So many people coming from Tri-County, we are going to be able to continue to serve at the same caliber that Tri-County did. So any questions?
Any questions for Jennifer?
Your location will still be in the same building, just on the other side?
Yes, and we have moved. If you were to come to our office on Willow, it's a complete disaster, but we're getting it cleaned up. One side is all prepped for the auction. The other side is where our offices are. And we had to do some reconfiguration to fit everybody, but we will be completely on the north side where the Vital Records office is. So we will continue to offer Vital Records out of that office.
Thank you.
Is Dr. Urbina doing anything else right now, Jennifer, or is it strictly just contract? I mean, not for the county, but is he still, he's not with Denver Public Health or CDPHE anymore, is he?
No, he retired probably, I don't know how many, 10
Long
times.
time
But he was gonna, he told us he would do this interim for a few months, but he's just having so much fun, and he's an Arapahoe County resident, that he wanted to do this longer. So this is, to my knowledge, the only contract that he's holding right now.
Yeah, he had been at Boulder County and did an excellent job during the pandemic,
Yeah, he's
as well as professor.
he's has a ton of experience.
Congrats on landing him.
Yes.
Jennifer, I just wanted to congratulate you and your team for getting this in place. I think it's a heroic effort to have created this capacity in such a short period of time. And so I think it speaks to your leadership, and we wish you all the best.
Thank you. Much appreciated.
All right, are we ready to move on to the Adams County update?
Sure. And Joella, I don't know if Kelly did prepare a few slides for me, if we're able to share those, but I'm not sure I can.
I think you just have to go to the bottom of your screen and hit share screen.
Yeah, it still says disabled participant.
Oh, it does.
Yeah.
Ugh.
And
Lisa, any remedy, or Sue?
Joella, if you go, I can't see it on my screen, but if you're the host, there's a place where you can allow multiple people to share. You drop down and click multiple people, and that will give Brian access.
Okay, so Let me go to participants. I'll try that.
Hey, Jennifer, while Joel is doing that, can you remind us the update on how many of your new employees will be from Tri-County?
I did a calculation, I think more than 150. That does include people, it's around 150. So as you might know, Tri-County Health Department hired a handful of folks toward the end of the year to
Okay.
continue to be able to do what we needed to do. And we had so many vacancies. So it does include those numbers, but at the right at the very end in this last month or so, a lot of the employees have come from external, or they were former Tri-County employees who left Tri-County and then applied for Arapahoe County Public Health jobs. But I estimated there was like 150 coming from Tri-County.
Okay, that's great.
More than security.
And Joelle, if it doesn't work, I can just ad lib a couple of slides just
Yeah, I can't find it.
without sharing. So I'll just. I can give
Sorry.
no, that's fine. I can give just a couple of quick highlights. Since we were just kind of talking about staffing, I know one of the slides she had was, the overall staffing number that the Board of County Commissioners approved was 176.75.
Brian, I found it.
Oh, you did?
Yes.
Okay. All right, can you see that?
We see ya. Thank you.
Yes.
Okay. And still see it in presentation mode?
Yes.
Okay, so I'll just go through these briefly. Just in terms of like leadership updates, the overall timeline. Some of these I think you may have seen where she presented before, the staffing and budget and funding. Maybe a slide or two around what's different in terms of what Adams is forming. Just in terms of overall leadership, I think you may have seen this before, although what's new, I think from last time, Dr. Albanese is the medical officer. She's come on in that contracted role. Melissa Sager has been representing the health department from the legal standpoint.
Excuse me, Brian, it's
yeah.
not moving. It's not in presentation mode. And I see your first slide and not the third one. And I can see all the slides on the left.
Of course.
Of course, why not?
Uh,
There, now it moved.
There we go.
is that any different?
The one.
I see the first slide.
Yeah. We're just seeing the first slide, it looks like.
How about now?
There we go. That's 2. Click down to 3.
Brian, do you
Yeah.
have it in presentation mode on your screen?
I do.
You may be sharing, sometimes with Zoom, it's sharing, I don't
Yeah.
know how to put this. It's not sharing the presentation, it's sharing the actual PowerPoint program.
Yeah. I mean, if it's all right with you, if I just, rather than
Yeah.
finish with it, I'll just go down with in this format. It might just.
That's perfect. Let's do that.
Okay, sounds good. So what I was saying is Dr. Albanese has come on board in that medical officer role. Melissa has been serving as that county attorney support from the attorney's office. I think you may have seen this before, but division directors, Adam Anderson, former Tri-County Epi and Data Science, myself, Dr. Darcy Martinez, Public Health Nursing, Michelle Harris, I think is the most recent addition to the team then, so really about a month ago or so, Director of Nutrition and Family Health, and then Monica Bulig of the Health Equity and Strategic Initiatives. And I think you may have seen this before, but again, 5-member board, diverse backgrounds in medical and public health nursing, and Jeremiah, I know, is an Esri GIS expert. And so they meet every third Thursday, 5:30. And then they established that, I think, as you know, probably back in August, and they've been meeting monthly or even as needed since then. I'll kind of skip over this one, but I think for the most part, generally understand it's been quite a heck of a year. We're obviously up against it. Just really the staffing and funding has been obviously central to all of the efforts. I know a lot of grants have come in that that they've been applying for. In Q3, we did a lot of our regulation adoption, OWTS regs, body art regs, that sort of thing. And then ongoing, again, community engagement. I know Kelly has been meeting with the various cities in Adams County and giving updates to the city councils quite a bit. What I was talking about was the staffing. I mentioned that 176 number. So total out of that 185 that will be eventually, there's 146 filled. And then John, to your question you just asked, 110 of those are hired through the transfer process. And then there's an additional 5 from Tri-County sort of through the open competitive process. And then again, as I mentioned, open recruitment is continuing. There's still positions to be filled. 25 of those positions through PEG contract for the COVID-19 work have been filled. In terms of overall budget, been approved for 27.8 million. And I know that she's expected the county general fund contribution to be more than what was historically provided to Tri-County, with some greater emphasis, some greater needs identified and budgeted for. And then certainly the loss of economies of scale impacts that as well. But I know in her assessments, I think the budget is overall is comparable to many other similar sized jurisdictions around the state. A couple of things I know she gets questions of her, like what's different. These are just a sample of some of the programs where I know things are continuing or being expanded. Just a couple of examples in terms of like the health enrollment team. I know that whole team is coming over and is now under the Health Equity Strategic Initiatives Division, and really looking to connect programs a little bit more specifically there. Diabetes education and prevention. I know they're continuing the grant through 2023 that's existing, and receive the new CCPD for 3 years at a higher amount. Workforce development is another area, and really keeping a whole position that's really set within the department and not being absorbed by HR, to really focus on the health department needs and staff development and workforce development within the actual health department. Couple others, mental health and behavioral health promotion, whereas I know Tri-County had 1 position for 3 counties. I think she was able to get 2 full-time generally funded positions to support that work. And then school health is another area where I know, Tri-County had 1 position, and I think she's been able to secure 1 position, really targeted to increasing collaboration with schools. So that's just a sampling of some of the areas where I think she gets a lot of questions about, what's being continued and what's going to be different. A couple other areas, and I've already seen since the time I've been there, some enhanced collaboration between county departments, community safety and well-being. I know there's been already some focused discussions around housing, but certainly a lot of opportunities there. And then community and economic development is an area where I've been really more engaged in around air quality, land use reviews, and how the health department will work with the economic development department in doing a lot of that work. And so, again, I think just leveraging some of those relationships, legislative and policy folks in the county manager's office, to enhance some of that work. So the website has been a work in progress for several months. It really has been pushed out more formally within the last couple of weeks, but is still a work in progress, but is mostly developed with some ongoing pages that still need to be developed, but is really being pushed out more. And then I know we're working with the comms team in Adams County to do a lot of social media and direct program promotion and outreach. And lastly, I just know she wanted to express huge thank yous to the amazing Tri-County staff. And, you know, really with all of this transition, just how much they're an asset to the community, no matter where they land. And then thank you to the Tri-County leadership in those efforts there, and obviously to the Tri-County board for your commitment and continued service to the community. So I know she definitely wanted to express that. And lastly, just grateful for the legacy that Tri-County has given. I know it's the intention at Adams County to pay it forward. So that's the quick view of the slides that she worked on. So with that, I'll take any questions or
Perfect.
attempt to take any questions.
Any questions for Brian? Okay, not
I see John's hand up.
Oh, go ahead. Go ahead, John.
I don't really have a question, but I do want to congratulate both you and Jennifer for what I think Kai has already said, which is an extraordinary task that you guys, I think if I was in Las Vegas in March, I would have never bet either county would have been this far. So congrats to all of you. I know you've been quietly part of the work in Adams County, Brian, and deserve a lot of the credit that you're sharing from Kelly. So I just want to tell both of you how impressed I am at what you all have been able to stand up. And I love the idea of paying forward the Tri-County legacy, and I know you'll both be doing that.
I appreciate that. Thanks, John.
Yeah.
Yeah, Brian, Suncor is still in the news. And so I'm assuming you're going to be continuing your good work in this area to try and make sure that they're in compliance and work with the community groups and move it forward, because it's really become very controversial.
Yeah, thanks for pointing that out, Kaya. And yeah, it has been in the news. I can't remember if we shared before, but the air quality position that we had hosted at Tri-County that was paid for and supported by Adams County was absorbed into the Community and Economic Development Department at Adams County under their technical folks and some of their environmental programs. And so that's just another area where we know, while we don't have an air quality position per se in the health department currently budgeted, we'll be working very closely with the CED group and team in that position to work, very intentionally within, the Commerce City area and Adams County. I will mention too that I think we presented a while back before around this Love My Air program that we started at Tri-County. We did apply for a grant back in March to the EPA for continuous community air monitoring. Tri-County was awarded that grant in November, and we're in the process of transitioning that work to Adams County to still work across both Adams and Arapahoe counties and really continue that work. It's $400,000 over 2 years. And so there's a lot to do in air quality, and we'll be certainly very focused on it.
All right.
I have a quick comment.
Oh,
Just a quick
go
comment.
ahead.
Thank you. Thank you, Brian. I was very happy to see that you're continuing on with Adams County, because as you know, air quality is an issue for all the Front Range, not just Adams County, and Suncor has been a problem there for decades, right? 80 years? How long have you been there?
Long time.
Long time. Contributing to the significantly to the air pollution in the Front Range, as well as we know oil and gas continues to contribute to the Front Range. So, and that's on Arapahoe and Adams. So thanks. I'm glad
Yeah.
you're there.
And just thank you. And just, yeah, there's a lot more discussions around just in the environmental justice. There's a lot of environmental justice grants coming out from CDPHE. So not only the one we received from EPA, but where else can we support either within the health department or within communities that are applying for those EJ grants? There's going to be, and will be a lot more coming from CDPHE in the years to come.
All good news. That's good.
Right. Thank you so much for that update. That's really helpful. And I think we're excited to see what both of these counties do moving forward. And, you know, how they morph into meeting their own community needs. And, you know, it's great to see so many Tri-County Health Department staff, you know, filling these roles at the county. So we know that those connections are going to be continued with this new, as these new programs roll out. So very exciting things to think about moving forward. And I think all of us are just really grateful for all of the hard work that you guys did to try and get these health departments up and running to serve our communities the best way you can. I can't imagine what this past year has been like for you guys. And so, and I'm talking to several people who are on the screen and not even on the screen, a huge lift for staff to try and to get this all together. And it's going to be really exciting to see what public health looks like in these counties moving forward. So I'm looking forward to it. All right, any other questions or thoughts regarding the new health departments people want to throw out there?
Hey, Brian, you're a great stand-in for Kelly. I can see her directing you to lots of presentations.
Oh,
I don't have it all at the fingertips like she does, but certainly gave it my best shot.
good. Yeah, you did great. Awesome. Okay, well, let's move on in our agenda. Next, we have the update on dissolution, and we have Belen with us.
Yes, I get to talk about the unwinding instead of the setting up. But it really has been a pleasure. Very, very quality staff and quality people that I'm working with, and it's great. You know, we're really writing the book on how to do this. So the staff was so patient as we were giving misdirection one way or another as we were trying to figure things out. And it was a little bit of a balancing act, but we've learned a lot. We really, our priority, and I worked with John and the staff a lot, is to make sure we continued services, but yet allowed the staff to train, be able to help set up the new health departments and everything. And it was a bit of a balancing act, but, you know, kudos to the people who worked all that extra time to be able to do both jobs and get it done successfully. I'm happy to report, at least at my last count, 255 Tri-County employees have accepted offers at one of the two counties. Quite a few have also accepted offers at state positions, school districts, in the private sector. I'm not sure, but I don't think we have a lot of people that aren't looking forward to new employment at the first of the year. Some people chose not to find employment because they were retiring or other things, but I think our overall numbers are really pretty good. Some of the issues that we had to deal with, we had to deal with how you break up the data and still protect the data. And we had to be able to figure out how we could report, let the clients know exactly where their medical records were going to be. And we sought the court's help on that, and we were able to get it. I worked very closely with John. We really wanted to protect their privacy, but yet we wanted them to know, you know, what was happening and how it was going. But we ended up figuring that out. A lot of time on dividing up the equipment and making sure that the counties have what they need to go forward, but yet protecting money. There was actually quite a bit of equipment and laptops and stuff that were publicly funded through grants. And so luckily we were able to transfer those to the counties, and they're not going to have to pay for that. They just need to continue the grants. And we sought each of the program staff's approval on how we're dividing that up. But I just did walkthroughs of all of the offices or one of my staff, and it looks like they're pretty much ready to go, which is good. Want to let you know that the auction is going to be on January 9th, and this is of all the remaining things. It's on the south side of the atrium building. We have a lot of computer monitors and certain computer equipment, a lot of chairs and just random stuff. So it'll be really interesting to see how it goes, but I'll make sure you get copies in case you want to buy anything.
When is that? I know some
That is
nonprofit-
on January 9th.
And you're sending it out to like Campo or nonprofit networks?
You know, the auctioneer does a lot of this kind of work, and I think they're getting out to everybody. They do all the bankruptcy work. They do a lot of nonprofits and things. I'm kind of relying on their marketing, and now I'm doing marketing too, trying to get you guys to sign on the dotted line and buy something. I'm sure there'll be some really good deals. You know, we've definitely had some bumps, like I said earlier, that we were working through issues and trying to figure out the right thing to do. And then, you know, the state weighed in and they had different ideas, but we were able to get it all together. And I'm very happy to report that, you know, the transition has gone pretty smoothly. Not everybody would agree with that, but all things considered, it's been pretty good. The receivership will probably continue on until maybe sometime in May. We have to complete an audit. We'll be doing final billing. We've talked to the counties and they're going to allow us to communicate to our old Tri-County staff in case we have an issue with billing, so we can, you know, take care of that very cleanly. This has been really nice because everybody really tries to get along, and everybody, even the counties, want to make sure that Tri-County is dissolved appropriately. So it's made my job a lot easier. And that's really all I have. Any questions?
Questions for Belen?
So Belen, what is your ongoing relationship with the court? Are you having to get things approved, or do you just submit a final report in May and you're good to go?
I tend to get things approved. I went to the court to get approval to have the auction. We did go get court approval on how we were going to do our notices on medical records. I tend to like to have the judge weigh in on anything that comes up. He's right now working on the para-litigation. I sought his advice on, you know, how we're going to deal with that. So there's quite a bit going on. But I would anticipate there wouldn't be a lot more interaction with the court other than those items. There will be a final report, and there'll be one other filing before that when I ask how the claims process will progress at the end. Once we've collected all of the assets and we have the money, I'll seek court approval to say, how would you like, this is how I suggest I handle the claims process. Do you approve that?
Awesome. Julie?
Belen, you mentioned a final report in May, and I think you've done other reports to the court. Are those available as part of public record?
I think I'll have Randy answer that. I believe they're public record once they're filed. Correct, Randy? Sid?
Yeah, I think that's true. I think they are available. The court is maybe reluctant, but I think there can be ways to obtain those through the court with approval.
And technically the board is, Tri-County Health is a party, so I would think I would be able to share those with you.
Great, thank you.
Anything filed in a court is a public record unless the court seals it, which happens a lot in juvenile cases, but you guys aren't juveniles.
We can only hope.
Yes. All right. Any other questions for Belen before we let her go? Go ahead, John.
Yeah, not a question, but I just want to say that, you know, we worked a lot with the board during the spring about sort of what a path to transition ought to look like. The idea of a receivership came up. It took more time than we had hoped for that to be accomplished. None of us really knew exactly what it was going to look like. And I just want to say that while Bell Ann's right, there have been some bumps in the road. There have been honestly many fewer than I would have expected. And I'd say that for the vast majority of what we've accomplished, I think the receivership has been an extraordinarily valuable tool for Tri-County. There's just no way, the way state statute is written right now, for us to have wound things down. And as Bell Ann said, it's going to go 4 or 5 months into next year, nor could we have dealt with the financial matters we're dealing with. So I dearly hope that other health departments don't have to go through this, but I would say that this is, as Bell Ann said, she's been writing a playbook, and we very much, appreciated both the structure of the receivership and I'm not saying this because Bell Ann's in control of things, but she's really been terrific to work with. And I just want to acknowledge that publicly.
Thank you, John.
Great. Thank you so much. Definitely, this has been a learning experience for all of us. We didn't even know about receivers when we first started talking about all of this. So if anything, you've taught us so much. And yeah, I think everyone on the board, really appreciates all of your hard work and your dedication to helping us drive this ship home, because it's unprecedented, has been a word we've used way too many times.
Thank you. You've been great to work with.
Great. Thank you so much. And as we move on to our next item, I have to say, I feel a little sad about this. John, our last COVID-19 update. What am I going to do next month without a COVID-19 update? So please take it away. Share your last words of wisdom with us, please.
Thank you, Julie. Jola, did we figure this out? Can I share?
Yes, you can.
Perfect. Let's see if I can do as good as Brian did. Doesn't look like it will let me do screen share. So, Brian, you never figured that out, right? Can you guys hear me?
It says has started sharing. You have started sharing.
But it's a blank screen. Are you sharing the wrong
What are
one?
What are you seeing?
Click on the document.
Yeah, I'm clicking on it. I'm not getting it to work. Joella, do you want to try this?
Okay.
Maybe we're asking. Can you guys hear me?
Yep.
Yes.
I seem to be frozen. I can't see you. Can you see the slides that are, is Joella presenting them?
The only thing I could see is John Douglas has shared screen.
Okay.
Oh, there we go.
Now, wait a minute. Is this me or are you, Joella?
I think it's me.
I think it's me, actually.
Oh, okay.
Let's try this. Do you see final COVID update?
Yep.
Yes.
Okay, as Julie said, Julie took my punchline. This is the final COVID update. And I would have to say that I hope these have been useful to the board. It's definitely been useful to me to be able to kind of pull my thoughts together and to try to help you understand what's happening epidemiologically and why we made some of the decisions we did. So I appreciate your forbearance of one final hurrah here. A lot of these have come from our colleagues at the State Health Department who provided just yesterday some very nice updates, and I'll be using some of their material. So big picture COVID, we're in sort of a metastable pattern. Frankly, it's a better pattern than I would have thought we would have been in the week between Christmas and New Year's, and a heck of a lot better pattern than we were the past 2 years. In the last week, our cases, this is statewide, and percent positivity have declined. That's true in Tri-County as well. Statewide, the average number of cases has fallen by almost a half, the 7-day average from early December, which is a very big improvement. And we're even seeing declines in hospitalizations, which of course is the coin of the realm in terms of the severity. Overall, this is true across the country, although there's lots of regional variability. One of the biggest reasons for regional variability is the ever-evolving pattern of variants. The CDC nowcast variant model has gotten better and better over the, I think it's now 18 months CDC's been using this, where they take sentinel data, try to weight it for the population and come up with both region-specific as well as national data on what's circulating. If we'd had variant measurements at the very beginning, I think we would have been in better shape. I think this is actually one of the good things. I'm trying to think of a better term than that, but good things that's come out of the COVID pandemic is understanding how to do rapid fire genetic monitoring. And we've certainly now increasingly able to use that. Through the summer, you may remember or may not, we were dealing mostly with one of the Omicron variants, BA4 and BA5. BA5 lasted a particularly long time. In the last 2 months or so, BA5 is diminished, and BQ 1.1 and BQ1 are now the most common subvariants. They're the majority, although they're declining. And the new player on the block is XBB. Where that taxonomy came from, I don't know exactly. XBB is a derivative of BA2, which preceded BA4 and 5. And that was the second Omicron variant that was happening in March. And it's been through a number of mutations. I think XBB is something we ought to be paying attention to. And in your post Board of Health lives, I'll encourage you to follow the reports about these variants, because XBB does have some properties that are somewhat concerning. Number one, it's been increasing quite rapidly. And while it's only in our region, which is region 8, about 8%, nationally it's about 18%. And in the Northeast and the mid-Atlantic states, it's over 50% right now. So it's gone up rapidly. And we'll be having to take a careful look at that. I'd say sort of a minor bookkeeping issue. CDPHE is adopting a Committee on State and Territorial Epidemiology position statement of defining COVID-associated deaths. I'm not going to go into that, but basically, we're going to come up with an inclusion of cases that were associated with COVID, as well as those that were probably associated with it, as a common operating quasi-real-time definition, which will be supplemented by later, more pristine death data from the National Health Statistics Center. So this is what our curves look like. The last time I'll get to show you guys these curves. These are the state curves for cases on the left, hospitalizations on the right. I really like showing epi slides that don't look at just the last 2 months, but look at the big picture. And this goes all the way back to the dawn of COVID back in the spring of 20. And while the case trends on the left, I think have become increasingly misleading, because we're doing so much more of our testing with home antigen tests that don't get reported. The data on the right, the hospital stats, are really likely to be quite accurate. And I think it's gratifying to see how those have dropped. We're certainly not guaranteed through the rest of the winter to see that stay down, but certainly the decline in comparison to the past 2 years is surprising to me, and I think really gratifying. This is looking at the CDC Nowcast data nationally. And as you can see nationally, seen in blue here, XBB, sorry, I guess it's kind of purplish by the red arrow, XBB on top of BQ 1.1 and BQ1 now comprise about 90% or so of variants across the board. And there is quite a variability by region in terms of just the proportion of that. One of the reasons that we're worried about XBB and XBB 1.5, which I haven't mentioned, but this is actually an even newer variant, is they appear to be quickly, much more rapidly than we've seen earlier variants emerge, outpacing the current BQ1 and 1.1, likely to become dominant. Early studies show even more increased immune evasion, meaning that past infection and even past vaccination may protect us less than we had been expecting. And really, I think less than what we've been seeing with BA4 and 5. We still don't know about severity. In general, the new variants seem to be trading off rapid infectivity and immune evasion for virulence, meaning they spread more rapidly, but they don't make people as sick. However, trends in New York State, where hospitalizations have increased quite rapidly, raise the concern about maybe XBB could be an exception to that rule, and maybe it could behave more virulently. Once again, time will tell, and we'll all be watching that as we move into the new year. The monoclonal antibody treatments that we relied on fairly extensively during pre-Omicron as well as Omicron are not effective against XBB. We've pretty much just given up on the infusion of monoclonal antibodies. While they were highly effective when they matched the circulating strain, the rapid mutations have made it a technology that's less effective to be used. There is a combination of monoclonal antibodies. It's called Evusheld. I'm not going to pretend to try to pronounce the two monoclonals that are in that cocktail. These are recommended for people who either can't accept vaccination or have profound immunocompromise, that as a pre-exposure prophylaxis option, PrEP, and those are still being recommended. Good news is that the oral antivirals, particularly Paxlovid, appears to be effective against XBB. Quite interesting that an agent like Paxlovid, which is a protease inhibitor, appears to work more broadly than a monoclonal antibody which binds to the spike protein, which to me suggests that we're likely to continue to see this as an effective option going forward. And then finally, no brainer, we continue to feel that the Omicron booster, which is the bivalent booster that came out in September, will be our best protection against the newer variants, including XBB. And while I think all of us are disappointed, I am ending the year disappointed at what the low rate of uptake of the boosters have been, much lower than our first booster. And it really does spell out for our new health department colleagues about how we will convey the importance of what are likely to be repeated needs for boosters over time to our population. So I think are honestly experiencing some booster confusion and maybe even booster fatigue. This is a series of CDC community level national maps broken down by counties inside the states over time. And the main point here is to sort of show you the evolution. We were at these are based on a combination of case rates and hospitalization rates. So they're a little different than the old metric of community transmission. And as you can see, as you move from map to map to map across the top, we got yellower and oranger, i.e. hotter, and going from April to June to August. We cool down in the fall. We appear to be nationally probably at about a metastable level. If you sort of squint down and look at the yellow and orange inside Colorado, while the counties that are yellow and orange have varied from one month to the next, overall, Colorado has been in a fairly similar place. And really, over the last 6 months, all of our counties have remained in the green level, which is the level with the lowest rates of hospitalization. So we're starting off our new health departments with a somewhat optimistic place in terms of community levels. I just want to brag a little bit about what our Partnerships and Strategies program has been able to do for the calendar year 2022. I want to thank Alex Kellogg, who will be moving to Arapahoe County with Michelle Askenazi and Jennifer for both directing this program as well as tabulating it. I think let me start at the bottom. We've been working with partners to run a series of community vaccine clinics in a variety of locations, schools, faith-based organizations, grocery stores, governmental locations, community-based organizations, etc. Almost 500 over the last year, at which we've given out almost 15,000 doses of vaccine, with an average number of vaccinations or doses administered at each event of about 31. Upper right corner, we've also had some great community relationship building by our vaccine champions, who themselves have been involved and attended almost 200 events. They've been giving out both vaccines as well as masks and testing. And not only have we been doing vaccinations, but the home test kits have been very, very warmly received by our community members. And then finally, I'd like to brag about what I think is really a best-in-class community distribution program. This is a program by which we deliver rapid test surgical masks and N95 masks, not at vaccination events, but at community sites, particularly, for example, schools and public libraries. And since Chris Hauk started this program using resources from the state health department, we've been able to deliver and give out over 1 million rapid tests, 1.35 million over the last 12 months, over 250,000 surgical masks and 140,000 N95 masks. It's really been extraordinary. It does depend on continued support and funding for these sort of material, the test and the masking, which is, as I think you know, in some doubt. But the fact that we can work with partners in the community who aren't healthcare providers, these are public libraries and schools, for goodness sake. It's just an extraordinary demonstration of how partnerships can be effective in our communities. I want to show you, I'm switching slightly for a second here back to vaccines, but because Kai and Julie said, tell us the hot stuff in the last COVID update. And this is pretty hot. This is one of a couple of papers that came out in the MMWR a couple of weeks ago, looking quickly at how effective the bivalent BV booster dose was compared to various referent groups. So what I've got circled at the top is frankly the easiest comparison to make. How do people who've gotten the bivalent booster compare to people who never got vaccinated? And in terms of preventing COVID-associated hospitalization, that's the metric they use. 84% vaccine efficacy, keeping in mind that lots of the unvaccinated people have been infected, because probably 90+% of folks in America have been affected now. So that's a pretty strong evidence of benefit. If you look at folks that have received monovalent boosters, that's the MV, at various points in time before cases got infected, you see that the level of vaccine efficacy for people who got their monovalent booster greater than or equal to 2 months before illness onset, 73% effective. For those who got it 6 to 11 months prior to illness onset, 78%. For those that got it more than a year prior to illness onset, 83%, just about as good as compared to unvaccinated people. So this is very, very compelling data that at a time that BA.5 was beginning to dwindle and BQ.1 and BQ.1.1 was coming on the scene, the new booster is at least in the early days showing remarkable vaccine efficacy. My final sort of big cutting edge update is what's happening with the other respiratory infections. On the left slide, we're looking here at children's hospitalizations due to the big three viruses: flu in blue, RSV in green, and COVID in orange. And this has been, as you already know, a remarkable year in terms of morbidity due to RSV. The fantastic good news is that over the last 3 weeks, the RSV hospitalization rate, while it's still higher than flu and COVID, has dropped super dramatically. And while we're not, I'd say, completely out of the woods in terms of RSV, because RSV is usually a single peak infection during the respiratory virus season, I suspect we're probably beyond that. Now, what is beginning to go up, as you can see in children, is the blue line, flu. And while it doesn't look nearly as high, and it wasn't nearly as high as RSV, it's mirroring what we're seeing in the adult population, which is the right-hand curve. And this slide is looking at rates of influenza-associated hospitalizations. We don't monitor flu cases, but we do monitor hospitalizations. And the green line shows you that by a week and a half ago, our hospitalization cumulative rate was 36.3 per 100,000. Now you can see how that compares to previous years, 2018-19 in maroon, 2019-20 in turquoise, 2020-21 in orange, where we had almost no flu, 21-22, and then 22-23 again in green. We're clearly ahead of where we've been before. Now, it's possible that green line's going to flatten and we're not going to have a bad year, that we're going to have an early year, but not a bad year. But so far, the slope of that line is not showing any flattening. So my guess is that at least for the next 4, 6, 8 weeks, we're likely to see high levels of flu. And I suspect we're going to end up seeing this year being as bad as any year since the influenza pandemic of 2009-2010. And I've just got one more sort of, this is a slide, Jennifer, I'm putting in here partly for you and Brian, since Kelly's not with us, to be thinking about. You know, one of the, there were a lot of important lessons that we've already learned out of the COVID pandemic. I'm a big believer that we ought to be doing a more in-depth analysis, not as Tri-County, who's about to go away, or not as the new health departments, but as a statewide enterprise in understanding the lessons of COVID. And sadly, one of the lessons of COVID is that vaccine hesitancy, which got more politicized around the COVID vaccine than we've really ever seen, even with the measles autism story, has transmitted itself to the other vaccines that have typically been more broadly accepted. We've got a very large measles outbreak happening in Columbus, Ohio right now. We're seeing chickenpox outbreaks happening as we are seeing uptake of these routine childhood vaccinations drop off. And as demonstrated by a Kaiser Family Foundation survey and reported in the New York Times last week, opposition to school vaccine mandates, which have always been there, but by and large, it's been the opposition to what has been such a successful public health intervention has been quite limited. And this is starting to grow as well. And I just think that all of us as folks interested in public health who will be presumably involved in our disciplines, our work, or maybe even our retirement, and being concerned about and active in public health circles, this is a topic, an issue that I think we need to pay very careful attention to. And I think that's my last one. And I didn't even put a questions slide in here, but I'm happy to take any questions because you know I like to answer them.
Of course. Questions for John? Kaya.
Thank you, John. I have been reading about the situation in China where it appears as if they're just, the hospitals are overwhelmed, and we know they have unique circumstances, lower rates of vaccine uptake, for example. I'm just wondering if what your crystal ball shows about the future here, because I see some countries are already limiting travelers from China. People are starting to say maybe we should wear masks again. There's some uptake of testing, making people have negative tests before they get on a plane. Do you see the situation blossoming or getting worse in terms of the implications for the US and travelers who fly internationally?
Well, let me say that I think we've all been taken aback by the dizzyingly head-spinning rapid developments in China, where they went from zero COVID with protests in the streets 3.5 weeks ago to just basically moving out of that altogether. And I'd say it's a striking example when one moves to end what for the Chinese were almost a revolving set of lockdowns without other preparation. And sadly, it's really astounding in a state that you would think can make people get vaccines as an authoritarian state. The uptake of vaccinations, particularly in the elderly, with a not fantastically great vaccine, has really lagged. And although the data coming out of China in terms of cases, you know, is incredibly limited, that's in fact a major reason why the US put the testing requirement into place, is because the data coming out of China is so hard to track on. The hospitalization stuff, what we're hearing from the morgues, et cetera, these are anecdotes, but they're very powerful. Now, I don't really think, Kaya, that entry testing and travel, especially in a place like the US, where we've got so much of our own COVID right now, we don't really need the Chinese virus to spike things. We've got plenty of opportunities to spike it. What I do worry about is that when you have a tremendous amount of transmission and viral mutation, you create more opportunities for new variants to emerge. That's probably what happened with some of the early variants in India when there was a big explosion there. And China's an even more populous country. So I don't see travel restrictions playing a role. I've never stopped promoting the value of masks for preventing respiratory infections, as divisive as that became. I don't see us going there, although I do think that the criteria CDC set up with their green, yellow, orange, where when you have high community transmission and high community hospitalization, voluntary use of masks in public indoor spaces makes sense. I think that's still a tool we ought to be thinking about.
Jan, jump in.
Oh, hi. Yes, thank you, Dr. Douglas, for that update. It is distressing with my pediatric background, what you just covered at the end. I was just wondering, we heard about 2 weeks ago about the increase in strep A, and there were some deaths and things. I haven't heard anything recently, and I was just wondering if they're still seeing that in the hospitals or in the community with the children.
Yeah, anecdotally, Jan, I think they are hearing that. I think our surveillance for invasive strep is not as robust as we'd like. And one of the messages in the health alert that went out a couple of weeks ago was really encouraging providers to report these infections. Many of them are going to be laboratory-based reporting. If you have a positive blood culture for strep, that'll get reported. But things like strep pneumonia or strep necrotizing fasciitis, that's the soft tissue infection, those don't always end up in reportable microbial samples. So I don't think our surveillance is top notch. The Brits are clearly seeing a lot. They've got better surveillance out of their healthcare system. What I'm hearing anecdotally is that we are still seeing strep. The best theory seems to be is that just as influenza can often be a precursor for secondary bacterial infections, strep pneumoniae or Staph aureus in particular, RSV may be a precursor for bacterial infections as well. And while pneumococcal infections clearly follow RSV, but we have a vaccine for that, we don't have a vaccine for group A strep. So I suspect that's a big part of what we're seeing. And I'm hoping that as those RSV rates continue to drop dramatically, the strep issue, again, not so well measured, will fall as well.
Thank you. And you know what? I'm still consistently amazed that no matter what we ask you, you have this breadth of knowledge. I want to know where you get this all in your brain and how you can keep it, because I'd like some lesson. You just seem to have this wealth of knowledge, and it's been so helpful to all of us. And thank you.
Well, I just like preparing so I can talk to my friends about these things. So
over cocktails.
Got it. Dr. Faywell, go ahead.
John, with COVID, we've seen the long haul syndrome. Has anybody looked back at influenza to see if there's any correlation, if there's some syndromes that we might have overlooked? People have had flu, obviously, if they're elderly and passed on, there's nothing to see anymore. But with so many young people having COVID and having long haul, wondering if maybe a study should be done on influenza patients who are young and develop any lingering symptoms.
Tom, that's a really good question. I don't know of any studies that are doing that now. I mean, my sense is that, and again, this is largely anecdotal because there really aren't great surveillance systems for long COVID either, that we're hearing far too many anecdotes about young people who have persistent symptoms, particularly kind of weird things like postural orthostatic tachycardia, where they get dizzy when they stand up and things like that. And yet I think your question remains a very good one. Is there and I'd love to see a large scale study that looks at folks with no symptomatic infection, with influenza only, and with COVID to try to get a handle on that. It may even provide some pathogenesis clues, why is COVID more than flu if it really is more than flu? I'll also note that, it took us, it was only like, I think about 10 or 15 years ago that we made the observation that influenza could increase the risk of cardiac illness in the 2 months following flu. We think of flu as being a respiratory illness, but in fact, myocardial infarctions and vascular disease, it really shouldn't be related to muscle infection. Myocarditis is increased as well. And that took a lot of combing through medical records to make that observation. So your idea is a very interesting one. I think I'm a volunteer in a long COVID natural history study. I was a control until I got COVID, and now I'm a case. But maybe I'll mention that to the investigators at my next visit.
Okay, thanks.
All right, final questions for John before we move on. I'm not seeing any hands. Thank you, John. This is a great update. We really appreciate these updates. Like Jan said, it's not just what's going on with COVID, but it's with, you know, what else is going on at the time. RSV, we have strep, we have so much activity going on. So of course we all love these updates and they will be missed. So I guess we'll have to tune into our new health departments to see what they have to say.
Yeah, we've got some good medical officers. I know they'll be providing great information.
Exactly, yeah. All right, well, with that being our last informational item, our last item is actually a closing final board remarks. So this is our last board meeting, as we are all aware. This is our last time to kind of share whatever's on our hearts and minds. So Jan, kick us off. Oh, you're on mute though. Kick us off on unmuted. There you go.
Sorry.
There you go.
Thank you. I'd like to apologize for me kind of reading this because I wrote it out over the past week, many thoughts that I had. I didn't want to forget anything that I wanted to say. And I also want to make it to the end. So I hope I do. Anyhow, although this is a very sad moment for me, as well as many others, I have thought about all the things I'm grateful for with my experience with Tri-County. And I've had such positive final memories. So just a couple thoughts that I had. First one is I'd like to thank the Arapahoe County Board of County Commissioners, both past and present, for the opportunity and the privilege of being on the Board of Health as one of the representatives for the past year, several years. We won't say how much. It's been a rewarding experience for me, and I assure them that I have given my best efforts and dedication to help Tri-County Health Department secure the health of its 3 counties. And I also had a thought to the new Arapahoe County Board of Health. Thank you for working to set up a health department in such a rapid period of time for our county and to recognize the experience and the outstanding abilities of the many folks from Tri-County in your hiring process. To all of Tri-County, I feel like I'm writing a letter to Santa Claus or something. To all of Tri-County, Dr. Douglas, Jennifer, the EMT, Renee, the staff, thank you so much for the experience of working and learning with all of you. I've never met a more dedicated, intelligent, and high-performance group. It was truly a wonderful experience and an honor for me to be a part of such an exemplary organization. I wish you all much success in your future endeavors. To my fellow Board of Health members, both past and present, thank you for the opportunity to get to know you and work with you to help Tri-County to promote, protect, and improve the health of its citizens. Thank you for persevering during the difficult times with your dedication and time, which increased incrementally over the last few years. And lastly, to the citizens of Arapahoe County, we have had the experience for almost 75 years of having Tri-County as our health department to protect us. And it was one of the finest health departments. With the new health department formed and continuing to grow, I feel confident we will be able to have that protection continue. Again, it was a great honor and privilege to be associated with all of you in the Tri-County Health Department. I will miss you all, so thank you.
Good job, Jan. That was beautiful. Thank you. Do others want to speak up? You don't have to if you don't want to. Just an opportunity. I'll go next. So I think Jan really, honestly, you hit the nail on the head for a lot of the things that I wanted to speak about as well. I mean, for me, it's taken me a long time to get here emotionally. Just kind of seeing everything that Tri-County has done for our communities, what it's done to further public health. I mean, if you want to talk about the importance of public health infrastructure and everything that it's capable of doing, look at Tri-County Health Department. I don't know if there's probably a more award-winning organization, an organization that has generations of people who've worked here, who've contributed to just growing and protecting the health of our our communities. And so in that, I feel like it's an end of an era, because, you know, those are some big shoes to fill in. And to be honest, our world is different now after COVID. A lot of things have changed, and public health has new challenges that aren't just basic programming. Unfortunately, all of that work still needs to continue, but now we have additional threats of, you know, what John was posting to, increased vaccine hesitancy. We have really just the great divide on what public health is and what our role is and what people think we should be doing versus how we've been doing and protecting people for so long and serving community. So I think that I'm excited to see what the new health departments bring forward and how they choose to serve our communities in perhaps some innovative ways, some different ways, because, you know, it's a different world now. So I think that that's probably been the hardest thing for me, is just trying to kind of cope with that. But, you know, I hold Tri-County Health Department staff up on the highest pedestal. I think everybody who's worked for this organization is absolutely the best and brightest. And I'm so thankful to see that so many of them are going on to the new health departments, because that means we still have amazing people taking care of our community. And I think that brings me a lot of warmth. So of course, thank you, John and Jennifer and the EMT, for everything you guys have done, the extra late nights, the weekends, the endless amount of work you've done. I started on this board in 2019, so I had one quiet year, if you will. But, you know, for several years now, you guys have had a really tough job, and you have served with professionalism. You have served this community more than I think more people can even imagine. So thank you for all of the extra hours and time and stress and worry that you put in to, you know, keeping us safe and making sure that this transition was as seamless as possible, because it's so important that we keep doing the great work that we're doing. So thank you. And I don't know, being on this board has been one of the greatest opportunities. So I appreciate this, I don't know, opportunity in my life, and I learned so much, loved working with everybody. So it's sad to see it go, but goodbye. Final thoughts, anybody else? John, looks like it's you.
Yeah, I had a chance to have a great time with most of our Board of Health members and part of our EMT at our final dinner get together, and I got a chance to thank them in person. But because this is a public meeting, which is being recorded, and you know, we know that millions of people watch it, I want to publicly thank our Board of Health. I could not imagine working with a finer group of community people who care about community, people who care about a community enough to put time and effort and, you know, over the COVID years, blood, sweat, and tears as well into it. And I would have to say, as the executive director for the last 9 years, I could not imagine being better supported. And I can't imagine that our counties could have been any better served than they have been by the board that I've worked with. So I just want to publicly thank each and every one of you. I certainly hope we can maintain some kind of contact, because I have strong respect and deep affection for all of you. So to the board, thank you so much.
All right, any final takers for closing remarks?
Julie, I just want to say that I want to thank the board for the way they've cooperated with us over the years. And as we come to a time like this, when we have a legal entity that ends, so does the collective effort of so many good people come to an end today. This is a time when we we finish some of the work that we've done for this period of time. We'll all look to new opportunities and new ideas, but for the moment, it's difficult to say goodbye. But we'll get through that, and we'll move on to our new adventures and our new opportunities. But it's been great working in a collective effort with so many good people. I've really appreciated it.
Thank you, Sid. Okay, so with that, we are now going to move into an executive session, our last. I'm sure everyone is very excited about it. Sid, do you mind reading off or the I guess the legal requirement of this particular executive session we're about to move into?
Yes, I'm glad to do that, Julie. We'll be going into executive session now for the purpose of discussing attorney-client legal matters that relate to perhaps the para matters that we've been dealing with, as well as maybe some lease matters or employment matters. So there'll be attorney-client matters that are protected by their attorney-client privilege, and they are specifically protected by Colorado Revised Statute Section 24-6-402, subsection 4. And so under that protection, the transcriber will not be keeping a record of the matters that take place during this executive session.
Great, thank you, Sid. Can I get a motion to move into executive session, please?
So moved.
And a second.
Okay, so at this time, I'll have to ask anybody that is not on the board or that is invited to this meeting to leave.
See you guys. Thank you. Joella, was there another link?
There is another link, but I think we can still accomplish the same thing just by locking it. And as long as everybody has left, I don't see any that have remained that weren't invited. So I can just lock the meeting and then turn the recording off.
Okay, let us know when you're ready.